Hello everybody, today is a very special day. Today is exactly 1 year since I had my first hypnotherapy session with Neil. I'll just run you through my story. I know lots of you have followed my story and I thank you very much for all your lovely comments. You have kept me going this last year, but I did want to just come on just to tell you my story for the whole year and how successful Neil's programme has been for me. So it was around last March, March 2018, where I started noticing that my head felt like it was shaking. I couldn't see it shaking, and other people, friends and family, I used to say, "Can you see my head shaking?" And they said, "No, everything looks fine." So I forgot about it. I thought, it must just be me. So I carried on working. I'm an assistant head teacher, work full time. I've got a 13-year-old son, so he plays lots of sports. So I've got a very, very busy lifestyle. 100 miles an hour, never said no, always wanted to be involved in everything. Everything had to be perfect. I wanted my house to be perfect. I wanted all my washing, ironing done. I wanted absolutely everything had to be perfect. And I know lots of you are the same. It got to about May time and I found that my head was pulling to the left. And I was able to turn it back, but it was pulling. But then it got to the point where at the end of May 2018, my head was virtually stuck in a fixed position on the left. Obviously worried, I went to the doctors. The doctors thought it was muscular, and so sent me for physio. I decided to go with a private physio because I didn't want to wait, because I'm impatient and wanted everything done just then, So I decided to go with a private physio. I went the next day and I was alarmed with what he had to tell me. He told me that my problem was neurological. So alarm bells started to ring. I was then referred to the geriatric medicine department of a local hospital, who then said that he wanted to refer me to a neurologist. Being impatient as I am, I decided to go private and I went to a clinic called the Nuffield in Chester. I went to see a neurologist that practices out of Walton. I live in North Wales, so it wasn't too far to travel. I went to see him the following week, and in the point of obviously going to the physio to seeing the neurologist, my head was now in a fixed position to the left. I was unable to drive. I was still managing to work, but obviously it was difficult. I was also in a lot of pain. I was trying to hide it, but it was awful. So anyway, I went to see the neurologist. Within 5 minutes, he diagnosed me with cervical dystonia. I've got to be honest, I'd never heard of the condition. He told me that it was chronic, that there was no cure, that I was going to have it for life. And the only cure he told me was, the only treatment, not cure, the only treatment was to have Botox and to go on medication. Obviously, a huge shock, really upset, really affected I was just really down, upset, crying, didn't want to do anything. Ended up phoning my boss to tell my boss what had happened. My boss came to see me, with my head fixed to the side. I opted to have Botox privately. So I booked an appointment for the following Wednesday and I had 500 units of Botox, which is huge. I wasn't aware of that, but to be fair, speaking to other people, that is a huge amount. But to be fair, he said my symptoms were quite severe and I needed to have a large amount of Botox. I was excited thinking, oh great, I'll have the Botox, I'll be absolutely fine, I'll just have to keep having the Botox regularly, at which point he was going to put me on the NHS list, so I would get it hopefully on the NHS. Didn't quite go to plan. After my Botox, I was in absolute agony, couldn't even lift my arms up. I was just in excruciating pain, couldn't take my dress off. I was just lying on my back in absolute agony. I was told that it would start to work after 10 days or 2 weeks. I was on all of the forums, searching for information on you know, how long it takes. So I was optimistic, thinking, no, it's okay, sometimes it takes a little longer. However, it didn't work for me. I actually phoned my neurologist up and said, it's not worked. The only thing he could offer me was medication. And I wasn't keen to go on the medication because of the side effects. So I carried on and thought, it'll start to work. At which point I carried on working. And my boss came into my teacher, obviously, came into my class, could see that I was, my left shoulder was up here as well. My neck was turned, and also it started to affect my lip. So when I was speaking aside. It was heartbreaking. I didn't know what was happening to me. I was, you know, just beside myself. My boss signed me off for a week. I went home, cried, was on the sofa, felt so down, felt so alone. You know, everyone else was carrying on their life. I wasn't able to drive. It was just, I was in a really, really dark place. I decided to just search the internet. I was adamant that I was going to find something to help me. At which point I found Neil. I found him on Facebook, so I joined. To be fair, the neurologist gave me the advice to join some forums online to seek advice. So I found Neil, thankfully. Neil knows how grateful I am for everything he's done for me. He has changed my life, not just helped me with obviously the cervical dystonia and being able to, you know, control the symptoms, and you know, now when I go down the street, people don't stare at me. People are not always saying, oh, is your neck still bad? You know, he has changed my life, and I will be forever grateful to Neil. I emailed Neil the day I found him, and obviously explained my situation and said, would I be able to book an appointment with him? Obviously he was based in London, I was based in North Wales. I thought, I'm going to travel, I will do anything to help myself. You know, I was reading some of the stories on the forums, and to be honest, they worried me. I thought, I don't want to be like that. I don't want to have to take all the medication. I don't want to give up my job. I don't want to stop driving. I wasn't driving, but I want to be able to drive again. I want my independence back. So to be fair, Neil phoned me that afternoon. He emailed back pretty much straight away. He phoned me that afternoon and asked me everything. You know, obviously a lot of people say that cervical dystonia can be caused by a trauma. He spoke to me about, you know, possible things that could have triggered it. I had a hip replacement 3 years ago, nearly 4 years ago now. I was awake for the operation, so he said that could be classed as, obviously, that is a trauma. Also, I was under a lot of stress at work. I was, through my own doing, you know, I was putting too much pressure on myself. I had family worries, so it could have just been a build-up. Nobody knows. All I know is I was in need of help. I booked an appointment with Neil. He couldn't fit me until the end of August, so obviously at this point it was beginning of June. So, but he did send me his free relaxation audio, which I started to use immediately. You know, he gave me some tips about being able to relax and just change my lifestyle, because ultimately I could not, well, my body had stopped me. I wasn't able to carry on at the speed that I was going. So at that point, I booked an appointment with Neil, and he gave me hope. He made me believe that he could help me. I did the relaxation audio every single day, and I just kept saying to people when they asked me how my neck was, and obviously I was in that stuck position. If you go onto the group, you will see some pictures of the early days. As I said, exactly a year ago was my first session with Neil. So you will see the first picture of what I used to look like at the first session. You can see now, a year on, my shoulders are now level, and I have got pretty much full movement and full control of my head. I wouldn't say I'm there yet with the turning right. However, I know I'll get there. With Neil's support, I know that, you know, I was once stuck in that position, and now I'm obviously straight, but I can look right. But I know I've got a little bit of a way to go until it's completely back to how it was. However, I know I will get there. I'm back driving as well. I was back driving in the November. So I started Neil's sessions in the August, obviously August the 23rd, 2018. I booked the 6-session cervical dystonia program initially. However, because my symptoms were so severe, I realised that just having those 6 sessions, I wouldn't be back to how I wanted to be. So I worked with Neil for those 6 sessions, made huge progress within those 6 weeks. However, it was not where I wanted to be. I knew I had to continue with this program, because the program requires a lot of dedication. It's no good just doing the 6 sessions or however many sessions you have with Neil and then forgetting about it. You've got to change your lifestyle. You've got to be dedicated. You've got to take time out for yourself. I started to take an hour a night just for myself. I'd go and have a nice relaxing bath. I would use Epsom salts to relax my muscles. I would read a lot more. I would watch more. I subscribed to Netflix so I could watch lots of films. And I just started to say no. I decided to have a cleaner because I thought I don't want extra work to do. Plus, I was struggling with pain at the time. A year on, I am no longer in pain. As I said, I don't get stopped in the street now to say, oh, is your neck still bad? Nobody stares at me. I feel like I'm back to normal. I'm still doing the relaxation audios, and I also do religiously on a Thursday evening, I do Neil's hypnotherapy audio that he sent me following the program. In addition to that, I found that Neil really gave me that push and that extra bit of a, yes, I'm doing well, I'm going to carry on, I'm not going to stop, I'm determined that I'm going to beat this condition. And I liked having those sessions, so I continued to have them. I had, from my initial 6 sessions, I then went to 1 a month. And then following the 1 a month, I then went to 1 every 2 months. And I'm still having a top-up session with Neil because I feel it's beneficial. I know some people on the group haven't needed that, and that's wonderful. But I know that, and Neil did tell me that my symptoms were severe. And I just wanted to throw everything I possibly could at this condition. And a holistic approach was the way I wanted to go down. I'm not on any medication. I don't have Botox anymore. I only had the 1 round of Botox, and because I didn't have a very good experience of Botox, I decided to steer away. My neurologist had said, if you ever want to have it again, you can do. However, I did say, if you don't mind, I'm going to try the hypnotherapy. It's been the best decision of my life to go down this road with Neil's program. My main purpose for coming on to the group to talk, I've never done anything like this before. My main purpose really was to help others. A year ago, if I'd have listened to this audio and had seen somebody who was able to now control their symptoms and get on with a normal life, obviously a new improved life with, I'm a much more relaxed person. I do say no. I don't work now until 1 o'clock in the morning. I decided to say to myself, right, I'm not doing any work after 7 o'clock, and I've stuck to it. I feel great. I wake up every day and I'm grateful. I'm grateful that I'm able to drive. I'm grateful that I'm able to cook. I'm grateful I can go shopping. I'm grateful I can take my son to different places. And I'm positive. I think the main thing that's helped me is that I've stayed positive throughout this whole program. I'm not saying it was easy. There were some days where I struggled and I thought I'm sort of working so hard and I'm only getting a tiny amount of improvement. However, you've got to stick at it. I found sometimes, like Christmas time, where it can be quite stressful and full on, I found that I went backwards a little bit last Christmas, not hugely, but I wasn't making as much progress, and I sort of had a little bit of a plateau. But I didn't let it get to me. I thought, no, it's been a stressful time. I need to take time out, and I need to think about, you know, why I haven't improved. What is it? And it you know, it's understandable. You know, it's a busy time, Christmas, and I hadn't been doing my relaxation audios as often. So there were lots of reasons. One thing I did to make sure that I could keep on track of my relaxation audios, my hypnotherapy audios, and my conscious visualizations, I bought myself a calendar like this, and I wrote on it, I had a little code: V for visualization, R for relaxation, HA for hypnotherapy audio. So I just basically wrote down what I was doing every night, just to make sure that I was keeping on track of all of the programme. You have got to be dedicated to it to see an improvement. As I said, it's no good just having the 6 sessions or 4 sessions with Neil and expecting for everything to be fine. You've got to change your lifestyle. You've got to be committed. You know, but if I hadn't gone down this road, I don't know where I would be today. And I am just so grateful that I chose to go with Neil's hypnotherapy audio. He is an incredible person. You know, I am just a normal person from North Wales. You know, I just want to help other people. I want other people to think, do you know what? Let's give it a go. What have you got to lose? You know, as I said, I'm not in any pain anymore. You know, I am sensible. I don't overdo it. However, I've got to say it has changed me for the better. I think in life sometimes things happen, but sometimes they happen for a reason. And this happened to change the way I deal with life. And I don't get myself worked up like I used to. I don't worry half as much. I don't say no to the fun things. I used to turn fun things down to go and do my housework. You know, now I live, you know, I live my life. I do things I enjoy doing. I always have things to look forward to. Friends of mine have said, oh my goodness, you are a different person. And I really feel like I am, you know, as well as helping my symptoms, Neil has helped me deal with my head as well. I think a lot of people with this condition do, you know, maybe have OCD, OCD. Oh my goodness, I hate recording. I can't start again. I've realised I've been talking. You know, I have got traits of OCD where I have to make sure everything's spotless, everything has in my cupboards, you know, all of the labels are facing the right way. And I think a lot of people with this condition are similar. I may be totally wrong. I just hope that this little audio, even though they're not as professional as Neil's, and you know, I've never done one of these before, so to be honest, it took me ages to work out how I could get my phone in a position to record myself. But you know, as you can see with my neck now, you know, nobody would know there is anything wrong. As I said, my shoulders are now level. If you go back and have a look at my photographs of what I used to be, you know, and I've got to say, when I used to take a photograph after the session, it would take me 10 minutes to get in that position, because I'd have to do a conscious visualization to get in that position. And, you know, I look back and I thought, oh my goodness, I wasn't actually straight in those photos, but I felt so straight for those 2 seconds, because the rest of the time I was, you know, in this position where I had to sit side onto everything. And you know, to look back on those photos and to see how far I come, I've got to say I am really proud of myself and grateful, so grateful to Neil. You know, even if just one person watching this video signs up to Neil's program and gets results, I will be made up, because I will feel that I've helped someone, and that is my main priority. You know, I want to help others that have been in the same situation as myself. anyway, if you've got any questions, again, thank you ever so much for all of your lovely comments over this past year. It really has kept me going. It's, you know, given me that extra push that I've needed, you know, and I hope that I've, you know, covered everything in this little audio. But if you have got any more questions, you know, don't hesitate to ask. Thank you. Bye.